My name is Dr. Lauren Carroll. I've been working with Kids Health Connections for the last 1 to 2 years in my role as an executive director and a medical director. But I've actually been with the company for about the last 10 years because I actually started as a physician, and I would send my patients for the services that Kids Health Connections provide.
If you don't mind, just tell us more about Kids Health Connections in general.
So Kids Health Connections is a child care health access program. Now, this was started by the state of Michigan to fill in those gaps between the primary care doctor's office and actually with the family and neighborhoods. So we offer a lot of different services to help with health access, but also educations. We also give education concerning obesity, asthma, nutrition, just everything where we see a health gap in the community.
Why is the work so important that you're doing in Southeastern Michigan with Kids Health?
Well, in Southeast Michigan, particularly Detroit, we're seeing these gaps in healthcare within different populations that are even worse for like the whole entire, compared to the whole entire state of Michigan. We have a higher childhood obesity levels. We have higher levels of asthma in urban communities, which is mostly Southeastern Michigan. And there's so many different health disparities that we see in this region. So our services are very vital to the families that we serve.
So what's some of the programs that Kids Health Connections have?
So we have a match program, which is navigating asthma in the home through home education. So with that program, we actually have a respiratory therapist and other asthma educators work with families for education, and we actually go to the home and we do an in-home asthma assessment. And with that, we look at different triggers around the home which can worsen asthma. We also will accompany families and patients to actual doctor's appointments, so we help them decipher what their physician is actually telling them. And we also have an obesity prevention program called Fit Kids 360. Wow. Now, Fit Kids actually started in Kent County, another county of Michigan, but we developed our own program here in Detroit. And we've had phenomenal success with this program. So basically, we'll have students who are referred by their primary care physicians if they're in the obesity or overweight range. Okay. And what happens, we have cohorts every season where we actually go through nutritional training, education with physical activity mentors, and we also run a 5K in the summertime. And it's not just the kid that's involved, it's the whole entire family. So our programs really help with reducing some of those comorbidities that we see in children like obesity and asthma. And we make a lasting impact so they can carry on these healthy behaviors into their adulthood. We have a wait list of about 200 kids right now.
Wow.
So really we're at the point where we have the programs, but we just don't have the funding to help expand those programs.
What type of impact have you seen with KHC have with the kids in the community? I know you just talked about it a little bit with Fit Kids 360, but what other ways have you seen an impact? Was it good for psychological?
Oh, absolutely. So with our programs, our in-home asthma education program, we've been able to reduce emergency visits for asthma by about 80%. Wow. In all of our kids that have gone through our education program. And then also for Fit Kids, we've also reduced BMI, which is body mass index. It's an important indicator of obesity. We've been able to improve those numbers for our kids. We also have a program called Fit Families. We started this up about a year ago because after COVID, we saw that many families had a hard time adjusting just with self-esteem, resiliency, that kind of thing, and other behavioral health measures that we saw in the community. You know, after COVID, there was an increase in depression and anxiety among our teens and our youth. So we instituted a Fit Families program, and actually we've had so many good responses from our parents and our kids, just improved self-esteem, improved grades in schools, and just some further connection within the families and their households.
So what impact has KHC had on your day-to-day life and your kids' life? So when you said that it brought you closer, how?
So in our last session, it ended in June. And we did the 5K in August, I believe, the end of August. My kids did, and they completed. Yay, right? We learned about journaling. So to see that he was writing down his feelings, and I got to know him like that, and now we write letters back and forth. That's how I'm getting to know my son. And they started that idea. I would have never thought of nothing like that. So even he picked up on healthier habits where I didn't take it that seriously. I'm grown, set in my ways, but the kids did.
Kids Health Connections, it was able to bring you healthy physically and healthy, it sounds like mentally and emotionally as well,
Yes.
with
Yes.
being able to communicate through different avenues, different paths.
I felt like I gained a family. I'm a young single parent. I don't know what I'm doing. And when I meet with these ladies once a week, I learn something every time. And I'm just so grateful for them. I really am. I hope we can get more funding and I can continue this on because I'm learning something.
That's great. So you're able to build community amongst the adults as well. So it's not just beneficial for the kids, it's beneficial for adult connections as well.
Yes. Even I can go all the way back to the first time I walked in the building. So we normally have them at recreational centers in the city of Detroit. When I first walked in, I felt like I knew them, but I felt energy when I got there. And it was like I've been here before. It was a beautiful feeling. They was very welcoming, very kind, very understanding. They tried to explain everything. If you didn't get it the first time, they explained it again and again. It's good to hear it from somebody that looked like you.
That's amazing. So why do you believe donating to KHC, to Kids Health Connections, would be beneficial for the city of Detroit and Southeastern Michigan?
I know how it changed my life. And it's a single mom out there who don't know what she's doing that need this opportunity. It's very beneficial to learn how to cook a budget-friendly, self-sufficient, healthy meal for you and your children. That is a benefit. Learning how to communicate with your children in other ways besides yelling or the cell phone. That is awesome. That is very beneficial. Seeing your children connect with other children is a benefit. And then you get to meet other people that's going through the same thing, so you realize that you're not alone. I like the fellowship that it brings. If someone is to donate to this program, please know that your money did not go in vain.
Expansion.
Yes.
We've got the quality program. KHC has been around for over 15 years. So we use tried and true curriculums. We have amazing, phenomenal staff, but we just need more funding to expand to all of the city of Detroit, all of Wayne County, Oakland, and Macomb counties.
So 3 years from now, what is one goal you would like to achieve with KHC?
Well, 3 years from now, just that. We need expansion into all of Southeast Michigan. We use a community health worker model, and community health workers are phenomenal. They're actually there in the neighborhoods, talking to people, talking to families. And really, a lot of our community health workers, they're going back to the communities in which they live.
Right.
So having that connection and then having the medical piece along with that, we believe that KHC and our programming needs to be throughout Southeastern Michigan.